Hi, I'm Kate Motz, functional medicine coach. Thanks so much for being here with me. Over the last 3 or 4 months, I've received an influx of referrals, thank you so much, to kids of varying ages, about 10 years to 17 years old. And these kids have chronic headaches, irregular and painful periods, digestive issues, anxiety, mood swings, many other issues. And so this has just really been on my mind recently. And I just wanted to make sure that you and your friends know that yes, I can help kids too. I am a mother of three, and I know how difficult it is to be in a situation where your kid, child, teenager, they're having trouble sleeping, or maybe they're just not feeling well on the regular. Um, Maybe they're dealing with acne that just won't stop. And a lot of them today, of course, are suffering with anxiety, and it's debilitating. And I know that you want to help, especially if I'm talking to you, mom. I know you want to help, but you just don't know how sometimes. And so maybe you do like I did many years ago, and you see the pediatrician, or you see a specialist, or you see a few specialists, and you try to get answers. But instead of answers, you end up with a prescription that you don't really want because it has side effects, and maybe some of the side effects are really scary. Or maybe you've just exhausted yourself like I did, running from appointment to appointment, and still you get no answers. And so I just wanted to let you know that functional medicine coaching is something that can definitely help you and your kids. I take a very individualized approach to health for adults and for kids alike. And when your child has a health issue, step one is to figure out what the hidden stressors are. What are causing the problems? What are the root causes, or I call them hidden stressors? Once we identify the stressors, we can then know how to best restore balance to the body, whether we're eliminating internal stressors or just crowding them out. There are so many different ways, but this is how to best restore balance and allow their bodies to heal. This does involve sometimes changing some dietary habits, maybe some lifestyle processes, lifestyle strategies, I call them, maybe even replacing essential nutrients. But your kid's official diagnosis is actually it's less important than figuring out what's causing their health problems. So just to give you an example, let's just say that your child's suffering with eczema, or let's say acne, because that seems to be really common these days. So the pediatrician or the dermatologist is going to recommend some kind of a cream or some kind of a wash. With eczema, it's usually some kind of a steroid cream. With acne, it's usually some kind of a harsh antibacterial or some kind of a wash. And with eczema and like the steroid cream, for an example, this can do other things. It can thin and discolor their skin. Worst case scenario, it gets absorbed into your kid's body, and it actually can stunt their growth for some of them, or weaken their bones. Yes, that can actually happen because medications, prescriptions will bind to and strip nutrients from the body. And then, so let's say you use the cream because you don't know what else to do and no one's given you any other options. And so if the eczema gets worse, then you're probably going to be offered some other stronger immunosuppressant cream, or maybe some kind of an antibiotic. And I'm not against medication. I'm not against steroid creams or against antibiotics, but there are other ways to do this that have less severe, if actually less side effects completely. And by the way, these creams and these antibiotics do nothing to cure the problem. They're Band-Aids. It's like pouring little buckets of water on a forest fire. So what I'd like to suggest is that when we can identify the hidden stressors and the core imbalances in your kid's body that are continuing to fuel the rash, continuing to fuel the acne or the anxiety or the stomach issues, whatever it is, when we can find hidden stressors and the imbalances and eliminate them or correct them, it's something that will allow us to eliminate the issue and prevent it from coming back. So it's really a way to fix the problem permanently. Some of the things that are really common that I'm seeing with kids today that are causing a lot of these issues are things like food sensitivities. And a lot of times they're the things that kids are eating often and not even necessarily unhealthy foods. A lot of these kids have compromised gut, compromised intestinal linings, or we call leaky gut is another term for that, which is horrible for the immune system because the immune system resides in the gut. About 80% of it does. Many times I'll find an overgrowth in yeast or some harmful or opportunistic, I call it, bacteria. And a lot of these kids have deficiencies in essential nutrients. So their cells are not taking in and utilizing properly their vitamins, minerals, antioxidants, the really important things to keep the cells functioning properly. So when we know the causes behind the health issues, we can fix them for good. And this is true whether you're 80 or 8 years old. You know, our kids today face so many stressors. I feel like way more than when I was a kid. You know, they have so many processed foods in front of them. Social media is a big stressor. There are so many environmental toxins, and I feel like that's increasing on a very rapid basis. And I just feel like our healthcare system is so much more interested in diagnosing and prescribing than really taking the time to discover and address what the true underlying issues are. Trying to figure out what the internal stressors are and deal with them there at the root cause. And my life's work is dedicated to helping you identify and eliminate the real reasons behind your health problems and the health problems that your kids are facing so that you can get healthy and stay that way. And I'm here to support you and your entire family. So thanks for being with me today. Again, I'm Kate Motz, functional medicine coach, and we'll talk to you soon.